Good to see you.
How are you?
Good. Well, you decided to have surgery. Why don't we go through a little bit of the things prior to surgery going into it that may answer some of your questions and ease your mind. So if you do any activities prior to surgery, exercise and whatnot, continue kind of the same routine that you've been going along. Don't change anything drastically with your exercise routine going into surgery. There are some conditions that may benefit from what we call prehab or rehabilitation prior to surgery. That's usually used to regain motion or to help early strengthening prior to surgery, and that will help you in the recovery afterwards. If we're going to do that, we'll refer you to therapy prior to surgery, and we'll coordinate that through the office. Prepare your house going into surgery. So if you're going to be using a walker, using crutches, or even using a sling, make sure you clear any loose rugs or cords around the house that could be obstacles and cause you to trip, and try to prevent those things from happening after surgery. Make arrangements with any work or any other house responsibilities that you have. And if you need any FMLA paperwork or other paperwork done, then we can complete that in the office. But just know that you may not be able to drive for up to 6 weeks after surgery, and you may need some help doing some activities of daily living, and you may need to coordinate with family members or friends to help you with those activities. If you smoke or use any tobacco products, we recommend that you stop doing those things prior to surgery, because nicotine constricts the blood vessels and it can increase your risk of getting an infection and can decrease wound healing after surgery. If you have any medical conditions that are managed by a doctor, I'd recommend you see your primary care provider prior to surgery to get what we call preoperative clearance. They will talk to you about the medical conditions that you have and do any workup that you need prior to surgery to make sure that you're healthy for surgery. You should also talk to them about any medications that you're taking ongoing, any medications that need to be stopped, and they will coordinate with the medications that you can use around the time of surgery, when you can continue them and when you can stop them. Specifically, if you're taking any anticoagulants or steroids and diabetic medications, those medications will need to be managed around the time of surgery. Going into surgery, all females that are able to have children will need to have a pregnancy test, and other surgeries may need more involved laboratory workups. Some patients also will need chest x-rays and or EKGs for clearance prior to surgery. The night before surgery, don't eat or drink anything after midnight, as it can be a risk for anesthesia complications during surgery. The night before surgery, I would like for you to use either Hibiclens or chlorhexidine, which are two soap products that you can buy at the local pharmacy, and wash your surgical site. This would be something that could reduce the bacterial burden in the skin and potentially reduce your risk of infection from surgery. Prior to surgery, remove any jewelry, don't wear any makeup, don't wear any contacts, and wear loose-fitting clothes to the hospital that will be easy to put on either over a sling or over a knee immobilizer after surgery. If you have sleep apnea, make sure you bring a CPAP or any other devices that you need to help you sleep at night. If you're having day surgery and you're going home the same day, make sure you coordinate with either a friend or a family member to take you home, as you will not be able to drive the day of surgery. We also recommend that you have someone sleep in the house with you after surgery, just as a safety mechanism to make sure that you're doing okay after anesthesia. If you're sick going into surgery, the days prior to surgery, please let the surgeon in the office know, as we'll likely reschedule you to make sure that you're healthy going into surgery for the best possible outcome. We'll see you the morning of surgery, and we're going to take good care of you.
Thank you.
You're welcome.